Why are doctors still injecting cortisone in tennis elbow? Here's yet another paper showing the difference between cortisone injections versus platelet-rich plasma, which I've discussed in previous videos. This 2023 paper by Campbell is entitled, "Is ultrasound-guided platelet-rich plasma injection more efficacious as a treatment modality for lateral elbow tendinopathy than ultrasound-guided steroid injection?" This is a prospective, triple-blinded study with midterm follow-up of about 2 years. This graph pretty much sums up the findings. You can see the patient-rated disability scale on this graph. The cortisone shot gives an initial improvement in symptoms, but things quickly return to the normal baseline. In the PRP treated group, the pain graph is initially much flatter, but starts getting traction as time goes beyond the 4-week mark. So to repeat my earlier question, why are doctors still injecting cortisone for tennis elbow or golfer's elbow? When we consider reports like these and others like it, we see yet again that cortisone has a short-term effect, but it quickly wears off. We also know that cortisone has many undesirable side effects, such as the blunting of the healing inflammatory responses. It has also been shown to weaken tendons and potentially lead to tendon ruptures. I personally feel that cortisone injections make elbow tendon problems last longer since they shut down inflammation, but in so doing, they counteract the body's normal attempts at healing the damage in the tendons. It has become quite commonplace to hear inflammation held up as the cause of a host of problems in the body. However, remember that inflammation is also a natural physiological response to injuries. It is part of your body's natural healing process. We need to be careful about using anti-inflammatories indiscriminately. Let's talk about naming for a second. Tennis elbow has long been known as lateral epicondylitis, and every doctor learned in medical school that itis means inflammation. So like for appendicitis, that's inflammation due to an infection in the appendix, and hepatitis is inflammation of your liver. Epicondylitis must also be inflammation of the elbow, right? Well, actually, no, that's not true. We know that from a paper in 2003 published by Dr. Nerschel over 20 years ago, that tennis and golfer's elbow is not inflammation at all. In fact, it's the utter lack of inflammation and healing that accumulates in this area due to poor blood supply that allows the tendon damage to become chronic. So inflammation is actually the first stage of healing, and taking powerful anti-inflammatories like cortisone can be very detrimental to any delicate healing that the body is trying to mount up. This paper by Campbell compared cortisone shots to another treatment known as platelet-rich plasma. If you look at the graph again, the blue line follows the pain scale over time, and you can see that as compared to the cortisone group, the platelet-rich plasma group, it takes longer to see an effect. However, over the long term, after the cortisone effects have long worn off, the platelet-rich plasma effects are just starting to compound. This ultimately leads to the tendon healing. So what is platelet-rich plasma? In a nutshell, platelet-rich plasma, or PRP, is a cell-based treatment that uses a patient's own blood. The platelets are isolated and then injected into the damaged tendon. PRP causes a number of processes to take place, many of which are inflammatory in nature. These processes result in a more robust response to the accumulating tendon damage, allowing the tendon to eventually heal. And once the tendon heals, it returns to normal strength and the pain tends to go away as well. Of the options we have, I find that platelet-rich plasma is the most straightforward and effective way to get rid of the elbow pain associated with golfers or tennis elbow. Cortisone injections may give some short-term relief, but PRP has a better track record of fixing the problem for good. Thanks for watching. If you know someone who may benefit from this information, please share the video with them. Also, please consider subscribing to the channel to learn more about the latest and best in shoulder and arm care. Thanks again, and I'll see you in the next video.